A patient might need a colonoscopy if they have symptoms such as a change in their bowel habit, such as bleeding mixed with the bowel motions, um, if there is a family history of problems with the bowels, and also quite commonly if they've had a positive bowel screening result. A colonoscopy is performed typically under what we call conscious sedation. So the patient is given a mixture of a sedative and also a painkiller, which the doses can be changed or increased so they are more comfortable. And the telescope test, as it's known, is then performed, typically by passing the long telescope through the patient's back passage and round the bowel to assess and inspect various segments of the large bowel. And you want to go from your back passage all the way around to the junction of the large bowel and the small bowel called the ileocecal valve. The preparation for a colonoscopy, if you're a patient having one, is the worst bit of the process because it involves typically taking a medication that cleans the bowels out, usually a mixture of salts of some sort to increase your bowel output. And the general rules of that are whatever particular bowel preparation you're having, to take it according to the specific instructions for that particular mixture at the right times, and usually take lots of water with the bowel preparation. It's also generally recommended that you don't glug and slug the whole preparation in a oneer, rather sip it so that you take it in small amounts. That way you are less prone to vomiting the preparation back up. So on the day of colonoscopy, all my colonoscopies in the private sector are done at Glasgow Nuffield Hospital. You're admitted to the ward. The nurses will clerk you in, give you a welcome, check your observations, make sure you're well prepared for the procedure. And then before your procedure, you're taken down to the endoscopy suite, where you are then given sedation and the painkillers, and then have your procedure. Is the procedure painful? Um, the short answer is that it can be uncomfortable, and we have to pass it. The bowel has nerve endings that sense stretching. So when you push the scope around the bowel, sometimes the wall of the bowel is stretched by the scope, and so you get cramps. And what I typically tell patients is that they will have cramps that will last 3 seconds, 5 seconds, 10 seconds, to breathe slowly through the cramps, and it usually settles in as the scope traverses or crosses that particular bit of the bowel. And if we need to, if it gets too painful, we just increase the dosage of painkiller to help the patient be more comfortable. So a colonoscopy, literally after the procedure, you get taken to recovery, and you get some observation for 5, 10 minutes, half an hour or so. Once you're fine, you go up to the general ward. I will then come and have a discussion with the patient to let them know what the colonoscopy findings were, what needs to happen next. Because the sedative affects the short-term memory, I like to give patients a paper copy of the report or send it out to them in the post a day or two later so they have that on the records. And that will contain the findings of the procedure, what needs to happen next, and the follow-up for the procedure. And the patient's GP will typically get a copy of the colonoscopy report, and I always send a copy of the scope report also to the patient's base hospital, so that if in 5 years' time or 10 years' time they're back at the hospital having something else done, that intervention is on the record.